Obviously, we have to start with a definition of health economic evaluation. A health economic evaluation looks at two dimensions, the costs of an intervention and the health consequences. And this is always done in a comparative setting. So the intervention of interest is compared to an alternative intervention, which is often current practice. So let's suppose that we have to compare two programs for treating or preventing a given disease. So we have to make a choice. And the choice is between a current program A and a new program or treatment B. Each of these two programs have a specific cost and also a specific outcome. So we have costs for A and cost for B. We have outcomes for A and outcomes for B. What we will do now, we will, in an economic evaluation, compare the costs of A and B and compare the outcomes of A and B. Of course, before we go into more detail on how to conduct these economic evaluations, we need to understand why we need them. Well, although budgets for healthcare are still increasing, the conflict between what we can afford in healthcare on the one hand and what we would like to do on the other hand remains, of course. And therefore, the challenge is to spend every euro or every pound or other currency as wisely as possible. The ideal investment is one that for each euro invested delivers a maximum of healthcare. And there, health economic evaluations can help us in identifying those investments. It's therefore very important to understand that health economic evaluations is about spending better and not spending less necessarily. The next question is, who is it for? Well, health economic analysis is not only of interest to society. Many stakeholders in healthcare are interested in the outcomes of these evaluations, not only public payers, but also insurers, also hospitals, and last but not least, patients and patient advocacy groups.